Hi, everybody, and thank you for joining me for our ConnectIE webinar. My name is Amber Mendoza. I'm the project lead on ConnectIE at the Inland Empire Health Information Organization. I'd like to introduce ConnectIE to you and tell you exactly what we are. We are a free one-stop interactive website for care providers and the public within the Inland Empire. We're a partnership between IEHP, Desert Healthcare District, 211 San Bernardino, 211 Riverside, and ourselves, the Inland Empire Health Information Organization. The platform includes community-based organizations within the Inland Empire that provide critical resources such as health, housing, transportation, income-related challenges, and many more. There are many benefits to ConnectIE. One of them is that it's a platform solely for connecting people to resources. It's a time-saving platform for clinical teams and healthcare organizations, and you have the ability to track referrals and utilization. You access ConnectIE the same way you would access any website. You can use your laptop, your desktop, or a smartphone. You would go to our website, connectie.org, enter the zip code for the area that the resources are needed, and click search. Finding the programs is really simple. You have the option to browse categories. We have a keyword search that you can use if you really are pressed for time. And you can use our filters to narrow your search results. We have program filters, personal filters, and income eligibility filters. Please know that any information that you plug into these filters is not saved. So we're not saving any personal information. We want to make sure that our patients and our medical teams are protected. So when you get to our landing page, this is what you see. Not a whole lot of bells and whistles. Our focus was making this platform easily navigatable and make it translate easily for the community and for the medical community alike. So in the red rectangle, that's where you're going to put the zip code that you're searching for, or you can use city and state if you don't have a zip code. And then you would click search, which is right below that in the yellow circle. All of our resources will come up in a program card. What you're going to find in these program cards are the programs are listed by program name first, followed by the agency that's offering the service. You'll see distance and location, what services are offered and to whom they are available, next steps to get in contact with that organization, a description of the organization and what they provide, their hours and location, and the results are going to populate in the language selected. English is our default, but we have many other languages that we can translate it into to make sure that we can reach everybody that we need to reach. And if you see something that's not right or something that should be changed, you can suggest that straight through the program card, and those changes will be done and uploaded within 2 business days. So once you go to ConnectIE and you put in your zip code and you do your search, so this search was Loma Linda Children's Hospital. That was the keyword we used up at the top left. You're going to see that there's 258 programs for Loma Linda Children's Hospital. So that we took the first one that came up, and you can see on this program card that the program is the Comprehensive Tobacco Treatment Program. It's hosted by Loma Linda University Children's Hospital. You can see their main services, other services, who they serve. You can save this, share this, create notes, suggest those changes. You can also see the next steps. You will see a green check mark in the top right-hand corner of that program card. That means that that particular program has been claimed, meaning we have had our boots on the ground going to these organizations and personally helping them make sure that all this information is true and correct. These are all the languages that our platform supports. We are powered by Google Translate, so while we try to do our best to have it translated as correct as possible, please understand that Google sometimes makes mistakes too, but for the most part, it's pretty translatable. There's additional features for care coordination on ConnectIE, such as creating personal accounts, creating favorite lists. Now, this is one of my favorite features for care coordination. You can create as many favorites lists as you like. You can name them anything that you want to name them, whatever's going to help jog your memory. And you can put in, so for myself, I have a food pantry, I have a transportation, I have a health folder, and I have filtered in programs that go underneath those. So if I have someone who comes in and needs help finding food pantries, I go to my food pantry folder, I print the list, and I can hand it straight to them. This is where it saves the medical community some time. You don't have to spend time searching every single time a patient needs a resource. You can have it readily available at your fingertips within your personal account. You can also share the resources with patients and others. There's a built-in referral process, as well as some administrative analytics with data on resources and searches utilized within the platform. When you sign up for ConnectIE, it's really simple. So you can sign up with your email address or with your phone number for texting. Please know that when you give us your email or your phone number, we're going to send you one verification email or one verification text just to make sure that we have your information correct. That is all you're going to get from us. We're not going to spam you to death with a whole bunch of unwanted emails. So again, we talked about creating favorites. So multiple folders can be created just as I discussed. You can print the resource content from your favorites directly. So again, you don't have to spend time searching every single time a patient needs a resource. You can share your search results. You can share them either by email or by text. So you fill in the needed information, you send it either by email or by text. Please know that your personal information is not shared with the recipient. So if you're sending it by email or by text, it's going to come from a dummy email address or a dummy text number from our carrier, our platform carrier, Aunt Bertha. So again, your information is not shared should you be sending this to a patient. We're growing and expanding ConnectIE daily. We focus on direct social services such as food, housing, legal, care, and many other things. If you see any inaccuracies, so if you know of a program and you've worked with them well, and you know that their hours that we have listed are not correct, please suggest that change. And again, within 2 business days, we'll have that updated for you. You can also suggest programs directly through ConnectIE. So if you know a program that should be listed but isn't, please go ahead and suggest that. And again, within 2 business days, we'll have that up and running for you. We have additional information available, live demos, administrative training, webinars and videos, marketing materials. Should you need any marketing material, or should you want me to come and do a live demo or some administrative training, please contact us at info@iehio.org, and I'd be happy to get that set up. This is some of the marketing material we have available. I can also email these to you so that you can print them at your leisure. The last thing I'd like to discuss is our simple search box option. So this is where we can really help save you time. If we put this on your front-facing web page, not only can the staff go and just type in what they need, so you would just do your keyword, your zip code, and click search. So the staff can do that, but so can the patient. So this is a front-facing thing where patients can maybe come, help themselves, and lessen the workload on you. So we would embed this, somewhere on your front-facing web page. We can also embed this on your intranet, depending on what works for your workflow the best. So this is the end of my slideshow. If you have any questions, please don't hesitate to reach out. Again, my name is Amber Mendoza, and you can reach me at info@iehio.org. Thank you very much.